I'm Susan Dubois. I'm an endocrinologist and I work for community care health centers and I support this work. Mary and I have been working together for about 10 years now, working with the Texas Stride family. So I'm glad to be here today.
So, Dr. Dubois, what is cholesterol and how does it relate to diabetes?
Cholesterol is a substance that we need in our cell membranes. And so everybody needs some cholesterol, and we get it through two sources. One is our body can synthesize it, and another is we get it through our diet. And most Americans get way too much cholesterol in our diet. And when we have too much, it goes to places where it shouldn't, and it causes damage. So the physiology here is that something will damage a blood vessel, and that something could be glucose attaching to a protein and making it change. And then in the environment of shear stress, high blood pressure, you get a little defect in the blood vessel wall, and inflammatory cells and cholesterol go to that place and deposit. And then that cholesterol becomes a plaque. And that plaque can grow slowly over time, or it can rupture. If it ruptures, that may cause a heart attack or stroke. But cholesterol, while necessary, we need to not have too much of it in our bodies.
So, with our Texas Stride participants, we do lipid paneling, and one of the things that we get is their HDL and their LDL. How would you explain to a patient what those measurements are?
A patient taught me that LDL is lousy cholesterol and HDL is happy cholesterol. So I remember that HDL is good, it's happy, and we can have more of it if we exercise and if we eat healthy plant-based fats like nuts. That will raise your HDL or good cholesterol. You can also think of cholesterol as moving about our bodies in little taxis, and HDL is the taxi that takes cholesterol away from the organs and back to the liver for processing, and LDL or lousy cholesterol is the taxi that takes it out and deposits it places. So LDL comes from animal-based fats. Right. So red meat, the skin of poultry and chicken, pork, bacon, sausage, these kinds of things. So we want to minimize those and maximize our plant-based fats.
Right. And how does diet impact cholesterol levels in the context of not only diet, but age and family history? And I think the most pressing question is, will that hot dog this July 4th weekend put me over?
Well, I think the reality of it is few of us have one hot dog on July 4th and stop, right? It's the potato chip thing where, no one can eat just one. So our habits are such that when we're in the habit of eating those things, it's not just one day, honestly. Right. If you did it one day a year, probably doesn't affect you. But people do it over and over and over again. So I think that your question, while relevant, is tells us that most people have habits. And if you eat hot dogs, you probably eat bologna and sausage and other things that are less healthy. So we need to do less of that and more of the other kind of healthy foods.
And so for patients visiting the doctor, how often should they have their cholesterol level taken?
If you're on medication, which the American Diabetes Association and the American Heart Association recommend that everybody with type 2 diabetes over the age of 40 be on cholesterol-lowering medicine, and your cholesterol is well controlled, checking it once a year is probably sufficient. We're not going to change much. Sometimes I check it more often if the patient hasn't been controlled or if they don't have access to medications all the time. So if I have a patient who maybe doesn't take their medicine half the time, I'm going to want to continue to check to see if we're getting to goal. Now, one thing that's really important to note is that I said everyone with type 2 diabetes over the age of 40 should be on a statin drug. Why is that? It's because these particular type of cholesterol-lowering medications lower the risk of a plaque rupture. So you put cholesterol in the arteries, it's deposited there, and these plaques early on are sort of soft, and they can rupture and cause a heart attack or stroke, even if you don't have a tight narrowing of the artery. And statins stabilize those plaques by decreasing inflammation in the blood vessel wall. One of the things that we know is that 30% of people who have a heart attack have normal cholesterol. And so if we were just treating the number, we're going to undertreat people. And I have had patients that have had LDL cholesterol in the 80s that most people would think is fine, and they had heart attacks. Now, maybe as many as 30% of people die with their first heart attack. So we don't want to wait until there's a problem before we start treating.
So you mentioned like things like heart attack and risk of stroke. Are there other effects, long-term effects of a elevated cholesterol level?
The first one that comes to mind is fatty liver. So when I was in training back in the 90s, we didn't even think about the liver as a consequence of diabetes. But what we've learned, and people did have a fatty liver based on an ultrasound or a biopsy, they just had diabetes that was uncontrolled and high cholesterol that was uncontrolled, deposits in the liver. Sadly, we think that diabetes will be the most common cause of cirrhosis in the future, leading to need for liver transplant. So we've got to take care of our cholesterol, keep that weight down, control the blood sugar, and that will help the liver.
And so for patients who are currently having a high level of cholesterol over time, is there a way to undo this cholesterol level and kind of undo the damage?
High-dose statins have been shown in some studies to reverse plaque. Again, once you have a well-established plaque, and that's just a cholesterol buildup in the artery when I use that word, sometimes those plaques will calcify. Calcium will deposit there. And so that's not reversible. But if you have that earlier stage plaque, sometimes you can get regression, usually with high-intensity statins, which would be something like atorvastatin 80 milligrams or rosuvastatin 40 milligrams. But prevention is much better than waiting. And so I would always say if we can get to that before, that would be what we want to do.
Wonderful. Thank you for your time.